to push the impure blood when the enemy is killed. So it grows quick. So it becomes small. Now, right ventricle, left ventricle. These are the fibers which I was speaking you about. This is the chordate tendineae. Okay? Chordate tendineae. And this is the cuspid membrane of the valve. This is the cuspid membrane of the valve.
Tricuspid.
The one which is in the left ventricle is bicuspid or the midfold.
Okay.
Left ventricle is bicuspid. Right ventricle you got tricuspid. So in this kind of, if there are 3 in this one, there are only 2 in this guy.
Okay, and that's why it's bicuspid.
Bi and tri. So this is the cuspid membrane. This is the one which actually stops the flow of the blood. As these guys pull it down like this, it closes. This is the one which stops you. Okay? So now this is the point where this chordate tendineae meet this guy. This is the papillary muscle. See, there are so many guys, other guys. See, if you open up this guy, there are so many ridges. This is a ridge, this is a ridge, this is a ridge. There is a ridge inside. There is a ridge here. All these are not papillary muscles. There is a ridge inside. Ridge
Just
inside.
that big one right there.
Only the one which is having the finger-like structure, which is exactly meeting the trabeculae is the papillary muscle. Okay? All you're asking also, where are the ridges? See how many ridges are there inside? All these guys, the ridges, all these guys. They're all ridges.
What are those called?
Trabeculae corneae. They expand the surface area and they push the blood with higher force. Okay? That's the purpose of these guys. So this is the trabeculae corneae.
Where's the papillary muscle?
This one is the
That's what he
papillary
was just saying.
This one is see, this is like a finger, see?
Yeah.
Finger-like. See, this is like finger-like here.
So is that also the papillary muscle?
Yes.
Okay.
Whatever that is connected by the chordate tendineae is the papillary
Anything
muscle.
that's connected to the tendon.
That's the point.
Okay.
Okay? So this is the big interventricular septum. See, this one here, this is very thick compared to this guy. The wall here is thin. Because it pushes with more power. So this is the cuspid membrane which I was drawing yesterday. Okay? Cuspid membrane, chordate tendineae, papillary muscle, trabeculae corneae. And these guys here, which are found in the auricle here, see these guys? These are the pectinate muscles. And they are also found in the atrium. These guys, okay? These are the pectinate muscles. The auricle is the muscular flap or the lid over the chamber. This is the auricle. And this space is the atrium. Space or the chamber is the atrium. The lid covering this guy is the auricle. This muscular member covering the lid is the auricle and the chamber is the atrium.
Where are the papillary muscles? Can you see them on there?
Yeah.
Right there.
They're the big bumps. Those big
How come on the
things.
model it looks like it's underneath the auricle? Like when you lift the auricle, there's all those papillary muscles.
They are the pectinate muscles.
Oh, pectinate muscles.
Yeah.
Where are the pectinate muscles?
Pectinates are in the auricle. Trabeculae corneae are in the ventricle.
Got it.
Totally different.
Yeah.
Okay? Trabeculae becomes papillary, but pectinate will not become papillary. There is no chordate tendineae.
Okay.
It is only an alignment to give the more surface area when it filled by blood. Expand, contract, that's it. But these guys are connected with the cuspids. That's why they got the papillary muscles.
Okay.
Okay? See now interventricular septum, and this is the
So that,
interventricular sulcus, which I was telling you the last name. Interventricular sulcus.
Where's
It's a
the
groove.
coronary?
It's a groove, and it has got blood vessels and covered by the fat.
okay.
So it lays intact all the time. Whatever the contraction of force of the heart may be, the vessel is always there. So the coronary sulcus is the one in this guy. See the fat, this one? Fat? This fat.
Oh, so that's how we know.
Coronary sulcus. This
Coronary
is
sulcus is
yeah,
fatty.
Yeah, this is
So
the coronary.
that right there.
Embedded with vessels. The vessels pass through in this guy.
And that's the auricle, right? The flap?
Yes, between the auricle and the ventricles, you got the coronary sulcus.
Okay, okay. Makes sense.
It
And
is on both sides.
which side was the anterior and posterior again?
Right guy,
Uh-huh.
left guy. So if you keep like this one, this is anterior.
Anterior. Okay. And then the back is the posterior.
The posterior.
The posterior.
This is the anterior interventricular sulcus and posterior interventricular sulcus. If you just lift this guy, the almost corresponds to the interventricular septum.
So how do we tell the difference? Where the apex is?
No, that.
The apex. This is the apex. This is the base.
Okay.
But you can't find the and superior and inferior vena cava clearly on this guy because they are not dyed first. There's no dye in this one.
Okay.
And it's kind of more pale. And you have to pass the probe to see where it ends up and where it lands in.
Oh, okay.
So that's more difficult to identify the vessels on a heart, but you can see the chambers. So right auricle, right atrium, pectinate muscles, the tricuspid valve here.
Where's the
There are. This is one cuspid. You got three. This one, this membrane. See, this is the cuspid membrane, and this is the chordae tendineae here. These guys, and this is the papillary muscle is here.
It's a tiny papillary.
Yeah, all these guys are trabeculae carneae. These ridges are trabeculae carneae. Okay.
That one's a lot smaller.
So this is a small one.
Okay.
So now the interventricular septum, again the papillary muscles, chordae tendineae, the bicuspid, is cuspid membrane actually. I was telling you about the interventricular septum. See this guy? At this point, see this one? It is from compared to this guy is a much elevated. This is much elevated. This one, see, it's like this. This part is much elevated. If you see this guy, there is deep one. It comes elevated and kinds of it almost kind of closing the aperture.
What is that again?
Interventricular septum. If I take off this guy out, see here the elevation here. There's a one in the picture they show you as it comes in.
I thought the thing down the center was the interventricular.
This interatrium, atrioventricular septum.
Interatrial.
Atrioventricular septum.
Atrioventricular
Ventricular.
septum. And
This
this
is the
one
one-
is called something different.
Interventricular. Atrium and ventricle. Interventricular septum is this guy.
Okay.
Interventricular, atrioventricular.
Okay.
Okay? That's it.
Well, and how about the vessels? How do we know, which one is this?
We don't have
That
to.
is difficult on this guy.
Oh.
Difficult, but you
So
can
the
see
asset on the monitor?
but you can see the you can see the semilunar valves in some of the guys. If you see this one, this membrane here, which are finding this one, it is cut. One part of the semilunar valve. You can this one. This is semilunar valve. Okay? Because this is the left ventricle, okay, big one, and this is the aorta. The one which goes from the left ventricle is the aorta. So now, based on the ventricle, you can say this is the aorta and this is the aortic valve.
Okay.
Aortic valve. Okay? That's it. If it is in the right ventricle, with one which goes out from the right ventricle, and if you have a probe, so it ends up here, this guy comes into the right ventricle. This is the pulmonary valve. So in this way, we have to ask. So it is difficult, and they had to ask this question.
You'd have to put a probe all the way through. Okay.
Okay?
What's that called?
Pulmonary
one?
valve.
The right ventricle gives the pulmonary trunk, and the valve at the beginning of the pulmonary trunk is the pulmonary valve. And the one which, because it's the left ventricle, aorta, this is the aortic valve, or the semilunar valve in the aorta. Okay?
Okay.
That's it.
All right.
What valves do we have to know for that?
Pardon?
What valve?